Hello, my name is Thomas Christopheropoulos. I'm the director of the Center on Aging and Health at the University of Regina. And it is my pleasure to announce the winner of this year's Center on Aging and Health Award for Innovation in Healthcare Delivery. So the award is intended to recognize an individual, a group, or an organization who have introduced an innovation in the provision of services to older adults with a focus on health. The award is adjudicated by a committee that comprises of older adults from the community. And this year's adjudication committee consisted of Ms. Marge Thiessen, Dr. Joan Roy, and Ms. Kathy Lai. The committee has chosen as the 2021 winner of this award the First Link program of the Alzheimer Society of Saskatchewan. The First Link program is intended to connect people with dementia with the resources and information necessary to cope and best manage the condition. It also connects their caregivers with the same types of services. And this program has received outstanding reviews from those who have used the program, with 88% saying that they learn more about dementia and the symptoms than they previously know. But perhaps more importantly, 80% indicated that they learn about how to use better strategies for coping with dementia and the symptoms of dementia. People have even said in individual comments things like, I don't know how I would have gotten through without them. This is a very deserving award. It's a deserving group for this award, the Alzheimer Society of Saskatchewan and the First Link program. And please accept our heartfelt congratulations. We're very sorry we couldn't announce the award in person because of the pandemic, but in the first opportunity, we will also make an announcement in our next live distinguished lecture. Thank you and congratulations.
You know, to me, what I really liked about, first of all, I didn't know about this LINK program before the group put in an application, and I read the material and the people's comments. And what I liked about it was it really was a link between diagnosis and getting help. Okay, because so often, and I know a lot of people who are in this situation, when your partner begins to show signs of dementia or, changing quite a bit, you just don't want to admit it to yourself, and you certainly don't want to bug the person about it. And you keep wondering, when is the time to make a move to get some help? So they often go to the family doctor, and the family doctor refers them for help. But it's a fear, I think, that a lot of the older people are really afraid when this happens to them, because often they're in their later years and, they're living together. They probably don't have an awful lot of activities. And you get one person, be it the wife or the husband, that has to help and assist the other individual. And it's a heck of a lot of work. And people really, I think, deal with the psychological issue of, am I being fair? Am I doing enough for my partner? How can I get more help for my partner? And they don't even say, how can I get help for myself? Which is a big thing, and making sure that they have, outside activities, contact with the other world. And it sounds like this LINK program is just ideal if the reference is made, say, by the family doctor, and right away they, as a couple, they're referred to this link group. I think it's wonderful. I really do. And, you know, it gives them such a guidance and they don't feel alone. So that's why I think it would be wonderful that they get this award. And because of that, it'll be more widely known within the community.
Memory loss is a natural progression in all of us as we age. Unfortunately, there are those who are aging who will have a greater need for the First Link program provided by the Alzheimer Society of Saskatchewan. Fortunately, though, the Society is there to provide information that will guide us as needed and is available to us prior to crisis.
I found the First Link program was simple yet innovative. It was someplace where you could go. It was person-centered, but also provided information. And a lot of the information, you wouldn't know where to go or how to get it. For example, it was information not only for the individual who may be affected with the disease, but also for the caregiver. How do I look after the finances? How do I do this? How do I do that? It was answering a lot of questions. It also provided early education support, and I think the early is a big thing in this. And if I understood correctly, you do not have to be referred by a doctor. You can go without a consultation, which is another thing, because I think a lot of are afraid. That big word, dementia, is a scary word. Most of us. The other part of it that's good is there is a learning series that are informative and provide the different types of dementia, what to expect. It also covers things such as financial and legal matters and other things that, you know, you'd have to consider, but maybe don't really want to. Because as long as you don't consider it, then maybe it's not real. Maybe it isn't happening to me. Maybe it isn't happening to my partner. It's a case of denial. It also enables an improved quality of life. And I think that's very important. As I said before, it's simple, yet innovative and proactive. Thank you.
Thank you to the Centre on Aging and Health at the University of Regina for awarding the Alzheimer Society of Saskatchewan the Award for Innovation in Healthcare Delivery for our First Link program. A special thank you to Patty Shawn, who nominated the Alzheimer Society of Saskatchewan on behalf of the Regina Support Group. Improving the quality of life for people living with dementia is the goal of the First Link program, and we're pleased and honored to be recognized for the innovation of the First Link program and the services and supports that it provides to people living with dementia across Saskatchewan. First Link is a program of the Alzheimer Society of Saskatchewan that connects people living with dementia to information, support, and services as early as possible after the diagnosis and throughout the progression of the disease. Early access to supports and services helps people to live well with dementia. Our client satisfaction surveys demonstrate that our programs and services have an impact on caregivers' ability to manage and thrive in their caregiving roles. 88% reported an increase in their knowledge about dementia and the warning signs. 90% know more about the Alzheimer Society programs and services. 60% indicate that they know more about community services, and 80% state that they have better strategies for coping with dementia and the symptoms related to dementia. I would also like to thank our referral partners for their role in the success of the First Link program. Research demonstrates that when clients with dementia are proactively referred to the Alzheimer Society at the point of diagnosis, they access vital information and support 11 months sooner than if they found the Alzheimer Society on their own. Many families are aware of the Alzheimer Society and dementia care services, but will not call until a crisis occurs. And unfortunately, there are others who are not aware of our services at all. First Link removes these barriers by enabling physicians and other healthcare professionals and community service providers to obtain consent and refer to the First Link program as soon as possible following the diagnosis. I would also like to thank our staff, and specifically our First Link coordinators, who connect people living with dementia and their family caregivers following their referral to help them access information and support to meet their unique needs. First Link staff connect them to education, programs, and services. Another innovation of our First Link program is that our staff follow up with our clients at least every 6 months to check in to see how they are managing and to ensure that we are there for them throughout the progression of the disease. 85% of our clients would recommend our programs and services to a friend, and this is a tribute to the dedication and the high quality of service and support provided by our First Link staff and the Alzheimer Society of Saskatchewan. And lastly, but most importantly, thank you to people living with dementia and our family caregivers. Thank you for your trust and support in the First Link program. Thank you for your feedback to help us to continually improve this program, and for your engagement and partnership to continue to improve life for people living with dementia across Saskatchewan. On behalf of the Alzheimer Society of Saskatchewan and people living with dementia, thank you to the Centre on Aging and Health for the award for innovation in healthcare delivery.